Let's move into Topic Tuesday. So this is Adam Ahmed, our third year, soon I'm going to be able to say fourth year, third year medical student who's helping us out with our Topic Tuesday. He's also the director of retail operations. So check out our latest shop, our it's sweat shop, or no, spread shop. I always want to say sweatshirt, spread shop. And the link for that's under our Hope Shops. But he is participating in providing us these amazing, wonderful Topic Tuesday posts. And last week, we talked a lot about the drugs that are used to help treat high blood pressure, including ACE inhibitors, angiotensin II receptor blockers, beta blockers. I'm going to butcher it, aldosterone antagonist. Oh, la, la, la. He wants to know if you can answer this week's challenge. So here's the question. What drug class, ACE inhibitors, angiotensin II, et cetera, all the ones I just mentioned, are the following medications? And he lists four: losartan, metoprolol, lisinopril, and spironolactone. And he wants you to kind of determine which one is in that classification. And no, he didn't give me the answer. So I can't tell you the answer, but I'll ask him for the answer. But think about that. I'm curious to know how many of you were able to retain everything. I know for me last week, learning about these hormones and how they're released in the body and how they produce higher blood pressure, and all of these ACE inhibitors and drugs that are named after these hormones and how they help reduce the blood pressure, I thought it was fascinating. But to keep this theme going of hypertension, and I believe this was the last week that we're discussing hypertension, he decided to talk about a very important class, which would be diuretics. And this is also important because it kind of plays into medication or Medical Monday that we just discussed. So sometimes diuretics are known as water pills. And I know a lot of people think that they're these magical pills that can take off 5 pounds of water weight, but it's just simply not really the case. It'll help you lower the amount of salt or water and your blood pressure ultimately in your body because it increases the amount of times that you actually have to urinate. That's what it does. So here's a little picture about the nephron anatomy and basically dealing with your kidneys. And I'm not going to go into all of this because you guys should check this out because I don't want to even try to screw up the whole process and the direction of the flow of everything. But as the blood flows through the kidneys, it's going to actually contain salt and water and waste that the kidneys will take, and it actually filters it before returning anything to the body. So there are several channels throughout the nephron functional unit of the kidney, and it actually works to reabsorb these things such as sodium, glucose, proteins, and water. Okay, so diuretics, what they do is they have their effect by blocking different channels in your kidney that reabsorb salt and water. And by blocking the reabsorber, these channels, these substances will actually remain in your body and remain in your urine instead of returning to your blood and will go on to be removed from your body when you use the bathroom. So that's the basic function of the diuretic. So there's several different types of diuretics. I'm sure we've heard of a bunch of these, and they all kind of have a unique function and a different type of an effect and potential side effects as well. So here's an article. He included an article from the Cleveland Clinic, but here's some highlights from that article. So thiazides, which are a specific type of diuretic, and these would be hydrochlorothiazide, chlorothiazidone. I think I'm pronouncing these right. Okay, so thiazides actually function by blocking a sodium chloride co-transporter, causing increased salt and water to stay in the urine. So their main benefit that's seen in patients is actually, if you have hypertension, it allows a moderate reduction of body in your body volume. So it's a moderate type of drug. And one other unique benefit from the thiazides can be seen in patients with recent calcium kidney stones. And this is because although the thiazides cause a loss of salt and water, they increase the reabsorption of calcium from the urine back into the body. So less calcium in urine means a lower risk of them hardening into a stone. And I'm sure all of us would like to avoid having the calcium kidney stones. So the main side effect of a thiazide type of a diuretic would be dizziness, and it could be a headache. Because this loss tends to happen relatively fast. It does not take long, really, for these medications to take effect and you're going to the bathroom. You can have some hair loss, some muscle weakness, which would be due to a decrease in potassium. Now, I have seen some of these medications with an added potassium in them, but again, these are all conversations you can have with your doctor and with your pharmacist to understand more about the specific medication that's being prescribed to you. Now, there's also a diuretic that's called a loop diuretic, and this would be furosemide, which is otherwise known as Lasix. And I cannot even pronounce the next one. Bumetanide? That sounds good to me. A loop diuretic actually functions by blocking a large sodium potassium chloride channel, causing massive loss of salt and water from urine. Whereas the other one we just talked about was moderate, this is more massive. And loops are much more powerful than other diuretics, and they can cause a significant reduction in volume from the body, meaning you're going to have to really, really, really go to the bathroom. For this reason, they're less commonly used in patients with hypertension compared to the thiazides. Because think about that. If you're losing all of this volume, you could potentially see, I would suppose, a significant drop in your blood pressure. So their main use is for patients that have congestive heart failure, so that really helps in getting that extra fluid off and around your heart. Main buildup use is for patients where the fluid can't be pumped by the heart, which causes many symptoms. Some of that would be difficulty in breathing because you can't get the fluid out of the lungs, swelling in feet, etc. Loop diuretics will actually help remove this fluid and really improve how they're feeling. And the main side effects of a loop diuretic is going to be dizziness again, headaches, potential for some hearing loss, for some muscle weakness again due to a decrease in potassium. So those are your loop diuretics. So it's just giving you a little bit more specific detail than the resource that we have in the resource section from Dr. Kristen Watson about these medications. She does mention these medications, but this is really a lot more detail about what this is doing to your body and those individuals that will be on these medications. Okay, the next one brings us to potassium sparing diuretics, and that would be triamterene, amiloride. I don't know if I put the emphasis on the right syllable. I'm trying here. But if you've noticed from loop and thiazides, one of the main side effects in these particular drugs is that they can cause a drop in potassium within the body, which we all should know. When you get those muscle cramps in the middle of the night in your calf and it forms a ball and you want to start punching it, it's probably because you have a loss in potassium and you need to increase that a little bit. So while a mild drop in potassium is usually tolerated by patients, some susceptible individuals could be at risk for a more serious side effect from low potassium, and this could actually cause heart arrhythmias. So potassium sparing diuretics might actually be a much more viable option for people because it allows a reduction in the salt and the water in the body without sacrificing the potassium. So that's a big difference from the prior two drugs that we just talked about. So they actually work by interfering the potassium channels in the latter part of the kidney and antagonizing the effects of aldosterone, which we've talked about before, which normally increases potassium removal from the body. So one of the main side effects from a potassium sparing medication would include hyperkalemia. It just means too much potassium. Now you've got too much in your body. Headaches and dizziness. So again, this information is purely meant for you to think about it, marinate on it, take questions back to your doctors or your pharmacist, because if you're experiencing some of these side effects, as you can see, there's a few different types of diuretics that your doctor can prescribe for you. And so depending on your blood tests and levels and symptoms and how they're impacting your blood pressure, all of this information is given to you so that you don't ever just have to sit uncomfortable with a lower quality of life. Speak up, keep a log, keep your numbers, have the conversations, share with them maybe some information that you're learning, and let your physicians make the decisions on any changes that need to happen. So don't go adding potassium. Don't go taking away potassium. Don't make decisions. Take the information in and make the phone call to the doctor. Okay, so that kind of wraps up this week's Topic Tuesday. And we're actually going to start talking about some of the drugs that's used for hypertension and more. Actually, I think this was the last installment for this and blood pressure. I think we're actually going to get into talking about some of the diagnostic testing and get into some really clear visuals of the differences, because we always talk about this test gave me this measurement, and then I had this test and it gave me that measurement. And what does the difference mean? Is one more accurate than the other? Many community members say, oh, you can only have a CTA to effectively determine the size of an aneurysm. That's not necessarily true. If that were true, what happens to the people that are highly, highly, highly allergic to the dye in a CTA? They're not getting accurate pictures, so it's not accurate. It might be preferred, but there are other accurate tests, and we want to kind of figure out why it's preferred. What does it look like? How are they performed? What are some of the standards you want to follow in having those tests? So that's coming up in future Topic Tuesdays. And again, if you have any questions, you can always reach out to us at info@aortichope.org. Topic Tuesday.